Welcome everyone to the mini lecture on spider bites. So the learning objectives for week 11, we've covered the first three in the main lecture. In this mini lecture we're going to look at spider bites, particularly the redback and funnel web. So let's start with a case. This is little Renee. Renee lives in Brisbane. She's a 7-year-old and she's been playing under her house in the sandpit, and she's found her dad's old lawn mowing shoes under the house and tried them on. So she's gone back inside, and about 15-20 minutes later she starts screaming in pain, holding her left foot. Her parents look at her foot and it looks like the left leg is quite sweaty and there's goosebumps or piloerection. So she's crying in pain, holding her foot, but there's not a single scratch mark or puncture mark on her foot. So this is what her foot looks like. Yes, it looks like an arm, but just imagine this is a leg, and there's goosebumps and also quite a lot of sweating. She comes to the hospital, blood tests and urine tests are normal. So what could have bitten Renee? Well, this is your classic redback spider bite. And this was this was based on my own family in Brisbane, where my daughter found a redback spider in my old lawn mowing shoes. So they're quite common, and these redback spiders are quite shy, and they like to live in dark, cool places. So exactly places under the house, inside boxes or inside shoes. And when they bite, they leave no bite mark because they're quite small, probably the size of your fingernail. And the venom causes calcium release and sympathetic nerve stimulation. And that's what causes the sweating and the piloerection. So the clinical triad of symptoms that you get with redback, you get a delayed onset of localized pain. Usually the delay is over 10 minutes. Then you get piloerection and sweating from the sympathetic stimulation, and there's usually no bite marks to be seen because the spider is very small. So what can we do about it? Well, first aid, you use an ice pack. Resuscitation, just check your ABCs. Now, there's about 2,000 redback spider bites per year, and there's been no deaths since 1979. Check for signs of envenomation, particularly heart rate, blood pressure, which might be raised, and but this could be from pain itself. And there is an redback antivenom, which was created in 1956, and you can use IV opiates as well for pain relief. There has been a trial a few years ago that showed a bit of controversy as to the efficacy of this redback antivenom and whether it actually made a difference at all. And then you can always call for help, the 24-hour toxinology hotline. So what did Renee have? Well, she had an ice pack, had some paracetamol and ibuprofen, was observed for another hour or two, and then went home with resolution of her symptoms. All right, case 2. This is little Finlay. Now, Finlay lives in Sydney with his parents and his brother. Now, he was playing in his backyard and he saw something big and hairy move into a hole under a moist, rotten log. So, being a 6-year-old, he grabs a stick and tries to poke it. And this big thing runs out and jumps on his arm and bites him in the hand. Now, he gets immediate pain and swelling to his right hand, and his whole body starts cramping up. So when he comes to hospital and we examine him, he's crying in pain. His forearm muscle has fasciculations, and he's getting body muscle cramps in his legs and his back. And when you look at his hand, there's a small puncture mark over his index finger. So this is Finlay's finger. You can see there's 2 puncture marks there. And this is muscle cramps of his leg. Yes, this is not Finlay's leg, but this is the only muscle cramp picture I could find on the net. So muscle cramps is when the muscle contracts and holds its contraction without relaxation, whereas muscle fasciculations is incoordinated contraction of the muscle fibers. So it's kind of like fibrillation of the heart, atrial fibrillation. but it's kind of fasciculations of the larger muscle groups. And again, 2 small puncture marks. So you got a visible bite mark there. So we do some investigations, blood count, coagulation, renal function's all normal. But when we do CK is a byproduct of muscle breakdown. We find that that is slightly elevated. So Finlay has signs of envenomation. He's got immediate pain, puncture marks, muscle fasciculations, and an elevated CK. What could have bitten Finlay? Well, there's really only one thing left. This is your funnel web. So the funnel web is quite a large spider and it's quite aggressive. So unlike your redback, which will prefer to hide, the funnel web can actually attack you. And it likes to live in moist forest regions, usually outdoors, for example, under a rotten log. And its venom is a neurotoxin that blocks sodium channels. And this is what causes your neuromuscular excitation. Now, interestingly, there's many species, I think over 30 species of funnel web, but it's only the male Sydney funnel web that has actually caused human deaths. And there's been only 13 deaths ever recorded, even though there's 40 bites per year. And again, there's been no deaths since 1979. There was the antivenom for funnel web was created in 1980, and since then there's been no deaths. So the triad of funnel web symptoms, you get rapid onset of severe pain, muscle spasms, muscle fasciculations, and you get a visible bite mark. Obviously not all the time, but death is from pulmonary edema, from severe vasoconstriction, hypertension, and leading to coma. And this is a picture of the funnel web hole and another species of funnel web spider. So what do we do about it? Well, funnel webs have been shown that doing a pressure immobilization bandage, I guess theoretically, will reduce the spread of the venom. Doing your ABCs, again, death is from acute pulmonary edema, so patients might need ventilatory support. Checking for signs of envenomation, and if they have severe pain, hypertension, crackles in the lungs, then you can give antivenom. And again, this funnel web antivenom was developed in 1980 for shock, severe pain, pulmonary edema, if you've got any signs of envenomation. IV opiates can be useful for pain as well. And again, call for help if you need help. So what did Finlay have? Well, he was treated with a pressure mobilization bandage. He had some, I think he just had some oral opiates because Panadol and Nurofen didn't quite work. And with supportive treatment, the symptoms resolved over the next few hours. And he didn't need antivenom. So in summary, redbacks are very small spiders and their bite causes a delayed onset of localized pain, causing piloerection and sweating at the site and of the limbs, and there's no bite marks. Whereas funnel web has rapid onset of severe pain immediately with muscle spasms and fasciculations from neuromuscular excitation, and often you'll see a bite mark because, I mean, look at the size of these fangs. That's why you'll leave a big mark there on your skin. So, spider bites. That is the end of the mini lecture. Thanks for listening.